In this video, we'll talk about how infectious diseases are transmitted from person to person, or more specifically, from your patient to you. This information is useful because if you know the way a disease is transmitted, you can break the chain and prevent you from being infected. So we'll start off with a question. How many people have died from Ebola total? The answer is about 7,000 since 1976. When the virus first emerged in 1976, about 7,000 people worldwide have died from Ebola. To compare that to how many people in the United States die each year from influenza. Depending on the year and the strain, between 5 and 40,000 per year. And this would be a non-pandemic year, such as the pandemic of 1918 was a lot more, but this is a normal seasonal influenza, 5 to 40,000. How many people die in the United States every year from car accidents? 2012, there were 39,000. What was so prevalent in the news over the last couple years? That was Ebola, and I think for a lot of people in the media, well, for the media it was sensational. They want to sell ads, and two, not a lot of people understand disease transmission. So when the first Ebola patient, the missionary doctor, came to Atlanta, and the Center for Disease Control said, that's fine, we're not worried about it. It's because he understood the transmission when a lot of the public did not. We'll talk about some of that, how that works. Elements necessary for transmission. Well, first, you have to have an infectious agent present. And we'll talk a little bit more about that. That infectious agent, you have to have the appropriate number of organisms to cause infection. For example, you can't get sick off of one influenza virus. You actually have to be inundated with thousands of virus to be infected. Virulence is the ability of the organism to survive in the environment. For example, HIV, if you take that out of the body, put that on the on your stretcher or in the back of your ambulance on the seat, it cannot survive in that environment. So that would have a very low risk of infecting you. Not that we wouldn't clean that up, but we would. And there must be a way of transition, a means of transmission. The agent has to come in contact with the cells or tissue it infects. It has to get from the person into your body and to those cells or tissues. And then we'll also talk a little bit about host resistance. But we'll actually tease some of these out a little bit. So when we talk about transmission of infection, we actually talk about a chain of transmission. And this is basically the way we get from the infected person to the next person. And there are generally 6 elements of the chain. Some books or some sources may have a slightly different way of depicting this, but I like this one. There are 6 elements in this chain. 1, there's an infectious agent, so like the virus, bacteria. There's a reservoir. That's where the agent normally lives, so in that infected person. In the blood, in the soil, like for example anthrax, on your skin for MRSA, a portal of exit, how the agent leaves the host. There's a mode of transmission, is that direct contact or indirect contact. We'll talk about that in detail. Portal of entry, how that infectious agent enters to the susceptible host. And then we'll talk about the susceptible host. Just because you come in contact with the virus or the bacteria does not necessarily mean you're going to get it. Your body has defenses, and some things if you come in contact, you may not get. So we'll talk about that as well. So those are the 6 elements of the chain of transmission. So number 1, infectious agents. So your book talked about pathogens. So pathogens are the organisms that cause disease. We have some examples here. We have the worms, the parasitic worms. We don't really talk too much about those. Over here we have a virus, and here's bacteria, fungus, and then we have protozoas. So bacteria is one of the most common ones that we talk about when we talk about infection control or infectious agents. Remember that those are single-cell organisms. They're capable of replicating themselves. They just need a suitable environment and a food source, so they can, for example, salmonella. If they have some sort of food source, warm environment, that's why we put things in the refrigerator to prevent that. But if they have the chicken or whatever, and it's an appropriate environment, they can survive and grow, and then if you eat it, you become sick. Some examples that we talk about: strep throat, MRSA, VRE, pneumonias, UTIs, urinary tract infections, infected wounds, bronchitis, and tuberculosis. Those are just some of the examples of bacteria. Generally, these are treated with antibiotics. Antibiotics kill or help kill bacteria. Just an idea of the size of bacteria. This is the head of a pin, like a sewing pin. And so you can see the little orange here, that would be the bacteria. Zoom in, you can start to see the individual bacteria. And then finally, here is bacteria. And this yellow bar is 10 micrometers long, so it takes 1 million micrometers to equal a meter, which is just a little bit longer than a yardstick. So we're talking very, very small. In contrast to your cells, these are actually some of your immune cells right here. You can see the teeny little bacteria. Bacteria are generally much, much smaller than your human cells. Some examples of bacterial infections. Here you have a skin infection or wound infection with bacteria. You can see this discharge here. We call that pus. I just want to remind you that when you were described this, you cannot say they have a pussy wound, because you cannot spell pussy. The real word is purulent. If you write pussy, people are going to laugh at your call sheet, but that's okay. Another skin infection here, pretty gnarly skin infected leg here, strep throat. And over here, you can't really see this well, but this is a pneumonia. So just a few examples of bacterial infections. All right, viruses. The big difference here is they cannot replicate on their own. They need to infect a cell, so they have to trick actually the host cell into pulling them inside. Once inside, they hijack the cell's machinery, and they produce thousands of copies of themselves, and then they'll bud off of the cell into normal virus. So this is just a picture of a virus. I think this is HIV or influenza. But you can see inside is the genetic material, outside is some sort of protein coat here, and this is actually influenza budding off of a cell. So inside this is an infected cell. It's producing these viruses, and then they exit the cell by budding off. And you can see this nice progression here of budding off, and here's one that finally broke free. Some examples that we run into: lots of viruses out there that make us sick. We have HIV, which is the virus that causes AIDS, hepatitis A, B, C, SARS, which is a respiratory virus chickenpox, which is varicella. I'm sure everyone's either had chickenpox or gotten the vaccine. Measles, mumps, Ebola, norovirus, probably the worst one up there. That's the one that causes your vomiting illnesses, your stomach flu. And then you have influenza. Just to be clear, when people say they have the flu, they should be talking about influenza, not norovirus. That would be your stomach flu or your GI virus. But influenza is a respiratory virus. Viruses are usually self-limiting, meaning that there's really no good treatment for them. The immune system usually has to fight them off. If you've had a little GI virus, you understand how that works. You get sick, you have some of the symptoms for about 24 hours, and then it's over. Your immune system destroys the virus, and you heal, and it's gone. Antibiotics are not effective against viruses, and this is a huge public health thing that medical professionals have to do. Is they get someone comes in with a viral illness and they're demanding antibiotics, and sometimes it's just easier for the doc just to give them a prescription for antibiotics. However, that just contributes to antibiotic resistance. So it's important to understand that antibiotics are not effective against viruses. Immunizations are really good with viruses. There are some immunizations for bacterial infections, but viruses, it works really well. Immunizations take advantage of natural immune response to the virus without the need for you to get sick. So instead of getting chickenpox, now you can get the chickenpox vaccine, and you trick your immune system into producing antibodies against it, and then the next time you're exposed to chickenpox or varicella, you don't get sick. Types of diseases, it's important to remember a couple of the terminology that we'll use. Infectious disease, so this is a pathogen that causes disease or illness in a patient. Example: norovirus, influenza, Lyme's disease, Zika virus, Ebola virus. Not every infectious disease can be spread person to person. Example from up there is Lyme's disease. You can't catch Lyme's disease from someone that is infected with it. You have to get bitten by the tick that carries the disease. So that would be an infectious disease. Malaria, same thing. You can't get it from someone who has malaria. You have to get it from a mosquito. That would be an infectious disease. Communicable disease, however, those are the ones that can be transmitted person to person. So most of those up there, so norovirus, influenza, Ebola, and possibly the Zika virus was that new one. You can potentially get that from person to person, whether it be direct contact, bloodborne, breathing in the particles like influenza, or sexually transmitted, so that would be a communicable disease. Reservoir, that is, as we mentioned, where the agent usually lives. Just a few examples of that. Norovirus lives in the gut, infects GI cells, and that's what makes you sick. HIV lives in the blood. Strep throat lives in warm, wet mucosa, which mucosa is the lining of your lips, your mouth, your throat, your nose, all the way down to your anus. That is what we call mucosa. But strep can't really survive the stomach, so it lives in the back of your throat when it gets a hold and colonizes. MRSA is another bacterial infection that we'll talk about, and that lives on the skin. It can live in the ears and the nose. Portal of exit. So the pathogen must be able to leave the host to infect another person. Usually it's the symptoms of the illness are the portal of exit for the pathogen. For example, that norovirus, that stomach virus, is diarrhea, vomiting. That's how the virus gets out of the body. Sneezing, nasal secretions, coughing, that's how influenza gets out of the body. But not all the time. For example, HIV is contagious even without the symptoms, but that is the portal of exit for HIV would be body fluids. Mode of transmission occurs in two ways. We have direct contact, so we have a physical contact with secretions that harbor the pathogen. Direct contact with the nasal secretions. Someone sneezes into their hand that has influenza. They touch our hands, and then we touch our face, and we could potentially get infected with influenza. Direct contact, like sexual contact with HIV or sharing needles, that would be direct contact. Indirect contact, organisms reside outside of the reservoir before it is transferred to the host. Example, MRSA. So you have a MRSA infection, or your patient does, and you get some on the stretcher, and your next patient comes along and gets that MRSA from the stretcher back onto that person, so they might then have a MRSA infection. And your norovirus, you get the virus on your hands after you use the bathroom, you don't wash well, you touch the counter, you touch some surface, and then someone comes along and touches that, and then now they could potentially get infected with norovirus. Infection control is largely focused on decreasing the mode of transmission. The mode of transmission, whether direct or indirect, that's where your infection control targets. For example, your patient is sneezing, coughing. You don't want to come in contact with those secretions, so you might wear a surgical mask. And a surgical mask is recommended for either you or the patient if they have a fever and they have those nasal secretions. Cleaning and disinfecting your ambulance also decreases indirect transmission. For example, cleaning is removing visible dirt, debris, for example, blood, vomit, that sort of thing. Disinfection is killing most of the pathogens. So you use some sort of solution, whether bleach or another cleaner that is a disinfectant to kill those pathogens. Just to reiterate here that it's important to read the label on your cleaning products. Even those Lysol wipes or whatever, they would require you to keep the surface saturated for at least 2 minutes to be effective. So if you're using those wipes, for example, or even a cleaner, make sure you spray the surface, let it set for about 2 minutes, whatever the label says. Some might say 5 minutes to achieve proper disinfection. Portal of entry. So the virus has left the person, and then then it's in some sort of contact with you. So portal. Now those pathogens must get into your body to the target cells. For example, norovirus on the counter of the bathroom, you touch it, the virus is now in your hand, and then you touch your hand to the mouth. The portal of entry would be mouth. In fact, norovirus is a fecal oral transmitted virus, which is pretty disgusting. Other portals of entry, we mentioned oral entry, aerosols. So you're inhaling the bacteria that is floated in the air after someone coughs, for example, and then you can breathe in that aerosoled bacteria, or it can get into your eyes and into the conjunctiva, which is the lining of your eye, or through the skin. You can get it through an abrasion or a cut in your skin or a needle. But you have host susceptibility. So as I mentioned, just because you come in contact with the pathogen does not necessarily mean that you'll get it. So host susceptibility. You must be susceptible before an organism is able to cause an infection. Example, your patient has HIV and he has a fungal pneumonia, and for whatever reason you didn't realize that he had a fungal pneumonia and you didn't put your mask on, and you didn't put a mask on your patient, and you're exposed to some of his secretions. He coughs in your face by accident when you're down talking to him. He coughs, you breathe it in, you don't see it, but some of the fungus enters your mouth down into your lungs when you breathe it in. But you don't get fungal pneumonia. And the reason is your healthy immune system quickly destroyed that fungus and prevented that fungus from establishing residence in your lung and creating a colony. So what we've been talking about is really your body's natural defenses. So we'll talk about some of those defense. Skin, intact skin. Organisms cannot physically pass through your skin, with the exception of some parasitic worms that can actually chew through your feet. Organisms cannot get through your skin. So if you get HIV blood on your intact skin, don't freak out. There is absolutely no way, if your skin is intact, for that virus to get into your blood. In addition to that, your skin also secretes chemicals and oils, some of which are bactericidal, which means they kill bacteria. And that's also true for your tears in your eyes. They secrete some things that actually help destroy bacteria. Conjunctiva, that's again the lining of your eyes. Your eyelids push out pathogens, so if you were to get something in your eye, your eyelids, just the way they work, they're designed to actually push out pathogens, and your tears wash away and dilute the pathogen. Remember the dose in the earlier slide. You have to have the pathogen in the appropriate dose to infect you. So that would be a defense mechanism, just diluting it by itself with the tears. In the lungs, you have mucus, which traps bacteria, viruses, fungus, things like that. You have cilia, which push up that trapped stuff, and then it goes down your throat into your stomach, where it's destroyed with the acid. You have immune cells reside in your lung tissue, and you have a cough mechanism, so you can cough out some of the pathogens. In your GI tract, it's very acidic. Most things cannot survive that. So MRSA, influenza, those sort of things cannot survive in your stomach. It's too acidic. In addition to that, you have digestive enzymes that break down food you eat, but it would also break down pathogens into proteins and things like that. And in your gut, there's actually lots and lots of bacteria that the pathogen would have to compete with for space. So you would, for example, C. diff is a bacterial infection. If your patient takes a lot of antibiotics for some sort of bacterial infection, and it actually kills the pathogen, and it also kills the good bacteria that lives in the gut. And then they may be exposed to another bacteria, pathogenic bacteria, C. diff, where that goes into their gut, and there's no bacteria there to compete with, so it can establish residence and infect that person with C. diff. If you were to come in contact with C. diff and actually get some of that into your stomach, and it survived the acidity of your stomach, it probably would not be able to establish residence into your gut, because you have so much bacteria that there's no space available. There's no room in the end, basically. So that just because you would be exposed to it, you have a low susceptibility to it if you're healthy. And then your immune system, you have macrophages in your tissues. We mentioned your lungs, but really in all tissues, macrophages are just white blood cells that engulf bacteria and things like that and destroy them immediately. You also have specialized cells that attack pathogens or infected cells. And you have specialized cells that secrete antibodies. Antibodies, as you can see in the pictures, there's a little Y-shaped molecule, and they are attaching. For example, let's say you've had chickenpox, or the varicella vaccine. So your body makes these antibodies against it. So you get exposed to the varicella virus, and in that picture you can see the antibodies that you make go and attach to it. It fits on the surface, attaches to the virus, and then now the virus will be rendered ineffective and cannot infect you. So that's kind of the basis of immunity. So the take home here: keep yourself healthy and get your vaccines, in addition to wearing the protective equipment and cleaning your patient care surfaces. Vaccines, as pictured in this picture here, you see the antigen, which is the chemical or the molecule that creates the antibody response. In this case, it could be chickenpox virus or influenza, and it's injected into your muscle. Your body has a immune response and triggers the antibody production. So the next time you see that antigen or the virus or whatever, you have all these antibodies against it. One last thing: incubation period. So the chain has been intact. You have the pathogen, the reservoir, the exit of the mode of exit, the mode of transmission, the mode of entry, and you're susceptible. You get it, and there's an incubation period, which is the time from the exposure to the onset of signs and symptoms of the disease. For example, the GI virus, norovirus, you get it about 24 to 48 hours later. You come down with nausea, diarrhea, sometimes vomiting, that sort of thing. During this period, the pathogen is reproducing in the host. It varies from pathogen to pathogen. Norovirus was 24 to 48 hours, but some viruses maybe hours. The influenza of 1918, it was about 6 hours, and some viruses are years. HIV may have an onset of signs and symptoms for years. So it depends pathogen. So in summary, in order for a communicable disease to be transmitted from person to person, these 6 things have to be in place. There has to be an infectious agent. The reservoir where that the agent normally resides. Without that reservoir, the infectious agent may not be able to survive. The portal of exit: the disease leaves the host some way. You have to transmit it either directly or indirect contact. There has to be a portal of entry into the host, and then the host has to be susceptible. And don't forget, the incubation period is the time from exposure to onset of signs and symptoms.